And with that, we'll go up to our weekly COVID-19 update. Kathy, you still on the line there?
Yes, I am still here. Thank you, Mr. Chair and Commissioners. Please let me know if you cannot hear me. And I apologize for not being able to be there in person. So maybe I'm sparing you 1 week, Mr. Chair, from not having to see me, but you still have to hear me.
Yeah, we appreciate that.
So I believe you all received the handouts on the data, the Minnesota case information. So as of October 26th, we have 2,328 confirmed cases. So those were 31 newly reported cases. We still have 43 deaths. And then we have our 14-day case rate per 10,000 people of 59.08. And that is a number that we are using as we meet with our K-12 superintendents. Now, I just want to state that number is, there's some confusion out there in the public specifically that is a be-all, end-all rate for schools to determine what their learning model should be. And it is not just the one rate that determines that. There are a number of factors that the K-12 superintendents are taking into account along with that rate. So they're really looking at all of their individual school districts, their numbers of positive and quarantined kids, the number of positive and quarantined staff. They're looking at their, keeping their environment safe in their schools. They're doing their social distancing, cleaning and disinfecting. They're looking at a large number of factors. So just for everyone to know, that is a specific number, but it is not the defining or the only thing that is determining that model. I also wanted to note some of the Cass County numbers. You see their 14-day case rate is higher. It's 78.73 for their collection date through the 12th of October. And then they also have another collection date, the 12th to the 25th, and that's 124.51. So Cass County is still significantly impacted by this COVID. Their case numbers are 8,794, and I apologize you don't have that on your form, so I'm just repeating that. The case number, 8,794 currently. They have 84 deaths in Cass County, and they are now working with 1,158 active cases. So that's just kind of a informational piece since we are, we operate as one metro area. It's good to know those Cass County numbers. Our Minnesota positive cases are over 135,000. The deaths are 2,353, and the positivity rate for Minnesota is 5.2%, and that's in comparison to the North Dakota positivity rate of 8.28%. So as you can see by also the trend numbers, as we have a grid that shows our number of cases, isolation, deaths, and active cases, and we have that weekly. You can see that there's a little discrepancy with the positive cases we have listed as a one-time versus our trend data. Our last trend date was October 22nd. So right now we're dealing with around 391 active cases. In the numbers of positive cases, as we've talked about previously, throughout September and October have really been on an incline. So we are monitoring those as we see more active cases. Now it does, it is part of our mitigation strategy to just continue to increase our testing. And as you all know, we have the semi-permanent saliva testing site in Moorhead. We were one of the 10 sites that they had chosen to set up this saliva testing. And so far to date, we've served 3,101 people at that testing site. I don't have all the data. They are trying to compile all of that information for me. But what I do know is on October 25th and 26th, those 2 days, we served a total of 516 Minnesota residents and 503 North Dakota residents. We talked about how they did open the saliva testing initially to only Minnesota residents, but as we worked with the governor's office, both in Minnesota and North Dakota, because of the number of tests that North Dakota provided for Minnesota residents, well over 12,000, when we didn't have testing availability on the Clay County side, we were able to work out an ability to have North Dakota residents tested at this site in reciprocation and working in one metro area. We know how many people work and go to school and really cross over that border. So this was an important thing to have happen, and we appreciate the governor's work on making this happen so this saliva testing can be available. The positivity rate so far through that saliva testing is 15.4%. And next week, as they can get more data to me, we're asking for regular information on that testing site. So I will have more to share with you the following week. So we are looking at that expansion, which is helpful because we see our cases rising across our upper Midwest. And really what we're seeing is there's so many asymptomatic people, and we need to get those individuals tested. As you may well know, the medical facilities are not able to keep up with all the testing. They're really doing symptomatic cases and of course others with hospitalizations, etc. But they just are not able to test everyone that would like a test. So this saliva testing is very helpful in that regard because the cases are spreading so rapidly. We really need to pick up those, what they call the silent spreaders, those that do not know they have the virus, they are not ill, and they're able to really spread this infection. So we're hoping with this saliva testing, it just is another way to be able to catch some of those people. We're really looking at a long, dark winter as projected, and if we don't continue to really provide mitigation strategies, and we're really concerned about hospital being overwhelmed as we wait for our vaccine. So the message is clear, and it's still the same, but it bears repeating that we really need to be conscientious of large gatherings. We're seeing across the state of Minnesota that there's been large outbreaks associated with weddings and large gatherings. We also saw breakouts of infection when we had the opening of our colleges, campuses, individuals socializing in large groups outside of the classroom. And we're still seeing that socialization happen. So we really want to let people know it's just those large gatherings, people not wearing masks at every opportunity, even for the smaller gatherings. So the next 6 to 12 weeks are really critical. It's important as we watch North Dakota being one of the highest states in the Midwest that is having really huge outbreaks and really needing a lot of mitigation. We really also know that Minnesota is not on the woods. Our numbers in our daily increases on Friday and Saturday, we were over 82,900 cases on Friday. That was a daily case increase, and then at 83,851 on Saturday. Our largest increase was back in July, our highest daily increase, and that was 74,800. So we're really seeing that increase. So we're really needing to push the need to continue our mitigation strategies. October 26th was our 19th consecutive day in Minnesota with over 1,000 daily cases. So what we need to do is continue to follow the guidance. We really need to keep on top of that community transmission. We initially saw the outbreaks in our long-term care facilities when the pandemic was early on. Now we're seeing the outbreaks in the social settings, and we're seeing the asymptomatic spreaders. So this testing will help us catch those people that are not yet symptomatic but are positive and are able to spread this virus. So we're needing to really watch that. We're noting in Minnesota what the data is showing is one case can really infect 3 others very easily. So wearing the mask, social distancing, avoiding the crowd, stay home when you're sick, get tested when you can. That's really an effort we're really pushing on everyone. We really want people to be vigilant. And so it's really important. I know there's a lot of skepticism out there about this mask. Do the mask really help? Does the social distancing really help? It's not an exact science. It won't stop absolutely every incident, but it will really mitigate the large spread. So we really need to be careful about that. We have super spreaders as well. I know there was one situation in the state where a super spreader spread it to 40 people. So we have even situations that we can note in that regard. So our schools are doing everything they should be doing. We're really meeting with the schools on a regular basis and staying up to date with what's happening in their schools, providing, we're able to talk through scenarios, answer questions. The K-12 schools are learning from each other. Higher ed is also working with us. We're talking through scenarios. We're sharing all the data, and they're doing what they can as well to continue to keep their students safe and their staff safe. So a really long-term solution at this point, until we get a vaccine, is really the personal behaviors with masks, social distancing, limiting, of course, the indoor gatherings. And as we look at upcoming holidays, we really are concerned, of course, because it will be indoor gatherings. And so the recommendation is that we limit gatherings to 10 people or less. There's nothing magical about that 10 number, but it's just a number to think about. How many safely can you really gather in your household, and or those even, maybe you have people in your family but are outside of your household. And you really need to be conscientious about the safety of that. And any sort of travel with family members coming from other areas is a pretty significant risk. So we want people to be very conscientious. We know what it means to get together for holidays, but this is a very critical time for us, and we just have to be so conscientious of being extra careful about that. The recommendation is still, of course, you're gathering in your household, but we want people to think long and hard about who they may include in their household for any holiday gathering. So that's just a very important message. I know it's a hard message, but it's really critical, and I want us to keep in mind, again, the next 6 to 12 weeks are utmost of importance as they work on getting the vaccine. We don't know exactly the time frame. We know the first initial doses are going to be a small number of doses. Will not get the major number of population, but we need to be mindful with what we can do now to continue our mitigation of this really very contagious, infectious virus. I want to note also that we do have our hotel open that we previously used for isolation and quarantine. We have a need in our community. We have someone on my team that is working directly with that hotel, with ensuring the security in all of the essential duties that we need to manage that hotel with the numbers we have. We certainly have, we have opened up just this last week, and we have about 13 that are utilizing our hotel so far. We do have a couple of arrangements. Again, we're working with our Red River Valley Task Force. We have a couple of arrangements because we know that the Fargo side also will have a means to have a location for those that cannot safely isolate and quarantine, particularly the homeless population and those in other situations. So we have an arrangement where we can work with some other organizations in our community, and they will be able to fund for their individuals that need to use our hotel. And we have all those details in play. We're managing that well, and so that is one of our mitigation strategies, because if you have some people out there, again, that are not isolated and not quarantined, the spread to the regular population and everyone is pretty great. So this is another means where we can keep those people safely, keep them away from others, and mitigate that virus. I went through a lot of information in a pretty quick hurry, and I apologize I didn't stop to ask if there was any questions. So I can do that at this time if anyone has any specific questions for me on any of the information I provided.
Well, thank you for the brief report.
You're so welcome, Mr. Chair.
Yeah, so the phone doesn't really make any difference.
No. I did have a question on these cities in North Dakota that are coming with the mask mandates. How does that compare to what Minnesota has in process right now?
You know, Minnesota has had that mask mandate for quite some time. The governor had put that in place. So that was a mask mandate across the state. So, of course, what we're seeing in North Dakota is not that. North Dakota is one of maybe 17 states that do not have a statewide mask mandate. So as we can see locally, what's happening across the state is they're having to make some local decisions to implement a mask mandate. They're also doing some media messaging about mask up North Dakota. So they're really making some efforts locally, since there hasn't been a mandate at the state level. I know that Dr. Burst from the White House did visit Bismarck. I believe it was yesterday, and she was she's going around to multiple places across the United States and just talking about she's talking about a number of things, but the masking is one of the things that she really felt was a need to really talk about, and she had expressed concerns in her public release yesterday that she felt like there was a number of situations that they noticed happening in the Bismarck area where the masking was just not, there was a lot of gaps in the masking. So she really expressed that there is so much work that needs to be done to continue that masking message. Now, Minnesota has done a good job, and we've had the mask mandate. We still have some gaps that we need to address on occasion, but the mandate is there. So Minnesota is not in the same boat as some of those other states that don't have that mandate.
Do we have a penalty then for not wearing a mask?
No, we really don't, but we do follow up. So if there's some hot spots or some gaps that we are alerted to, we do follow up with those. There's a follow up with any restaurant or bars that we license. If we are hearing of cases, my food, pool, and lodging inspectors are very quick and diligent about following up on those. And then if we hear about others, we are doing the follow-up as well.
Okay, if we could, just a minute.
I would just point out, Chairman Gross, there is a penalty under the mandate from the governor. It's a $100 fine, petty misdemeanor for persons. It could be enforced against them. It's a misdemeanor against businesses if they didn't enforce the actual mandate. We haven't really looked to put that onto people, but it is available. And that's probably one of the biggest differences between the Minnesota one versus North Dakota, where they're doing local. As far as I know, maybe the local one or the Fargo one doesn't have any kind of penalty. It's an encouragement thing to make sure people are doing it, and then telling businesses we need to have this done. But as far as I know, they don't have any penalty. We do actually have a penalty on it. We haven't seen that come through. We haven't had any tickets against people yet up to this point, but it is available.
Okay, thank you.
Yeah, thank you for that clarification, Brian. I guess my point was that we in public health are not, there's not a penalty through our licensing entities, but yes, there is one if we need to enforce that. We haven't had the need at this point in Clay County.
Yeah, it's just a little bit shorter explanation. Okay. Anybody else with a question?
Not a question, but as we move forward, whatever that looks like, I know that, Kathy, I really appreciate you adding the North Dakota piece so that we, since we are considering ourselves such a metro, to see what's happening across the river and just get us more of a cumulative understanding of cases and case positivity rates. My kids have been going to school, hybrid, and so the schools send out probably the same information you cover with the superintendents, but what the 14-day case rates are, and then they take that under advisement. But another piece that they've been following are the student positivity rates and the teacher positivity rates and how those change weekly, so that, as you have said before, it's not necessarily that they're getting it at school, they're getting it in these social gatherings. And my question maybe for you is, as you and the PIC committee and administration move forward in what customer service looks like at the courthouse, I think it would be important to just follow what staff positivity rates are, where those contract tracers are determining where they get that. I know we've taken the safety of our employees very seriously, and from the outside, from what I've heard, is that staff that may have been getting positive rates aren't necessarily getting it at work, they're getting it outside of work. But I think that's a piece of data that would be very helpful moving forward to continue to monitor.
Okay.
Yes, thank you, Commissioner Mojo. We certainly do communicate on a regular basis, and I know Darren in HR and Steve we're all communicating about what is happening in Clay County. I'm also communicating with Minnesota Department of Health and our epidemiologists on a regular basis to ensure that that we are still following our necessary guidelines. So thank you for that those comments, and we certainly will continue to do that. One other piece of data, and I'm sorry I'm taking another minute, is as Jenny mentioned, the Cap County data. I just received that currently for our Clay County residents, currently in ICU, there is 2 individuals in ICU at this time. There are 9 individuals hospitalized. So I just wanted to bring that to your attention as well.
Okay. Anything further?
Thank you for asking, but I better
Yeah.
quit.
I knew I took a chance with that comment, but okay. All right. Thank you for the good report there, Kathy. It's really been helpful to keep us updated on that.
Sure, you're welcome. Thanks for letting me present the information.
Okay.